This chapter is going to cover personality disorders, borderline personality disorder, antisocial disorder, and other types of three groups of different types of personality disorders. So some of them are quite interesting, and some of them that you may be able to relate to things that you've seen on TV or things that you've read or heard in the news. When it comes to the personality, this is what determines how people cope with their feelings and impulses, how they see themselves and others, how they respond to their surroundings, and how they find meaning in relationships and different cultural values. With personality disorders, these individuals are very rigid. They are not experienced as uncomfortable by as the individual, but we're uncomfortable. They often occur to have depression, anxieties. Their pattern of taking in information, how they perceive things and think about different things can also impair their function out in civilization and socially, and also in the workplace. This is one of those axis 2 diagnoses. If you remember from way back when we talked about the axis, this is the axis 2. And lots of times it's difficult to treat because they don't see themselves as having a disorder. With personality disorders, they have the ability to merge personal boundaries with others. Their boundaries act as filters, permitting what is acceptable in life and what is not. It's been shown that those who have very weak boundaries themselves tend to violate the boundaries of other individuals, and they don't feel like they're doing anything that is uncomfortable to others. Some common characteristics that there is no single cause that causes personality disorders. They likely can come around from interaction between some type of biological factor and the environment. These characteristics are that they lack insight about what they're doing. They don't have a deeper thought, they just act out. And they don't really think there should be consequences for their behaviors because they don't see their behavior as being wrong. When we talk about those defense mechanisms, many that you will see with those with personality disorders can be those listed here: repression, suppression, regressing, undoing, and splitting. Splitting is when they have the inability to incorporate positive and negative aspect of themselves or others into a whole image. I'll give you an example of that in class where I have one that I want to present. Commonly, we see this with borderline personality disorder, where the patient tends to characterize people or things as all good, or they're all bad. They don't know how to split the two. They don't know that people can be good, a little bit good, and we have a little bit of bad. They're saying you're either this way or that way, and that's that splitting. They just don't know how to divide that. So they're either saying everybody's good or they're not. So an example might be that your patient might say, you are the worst person in the world, and later in the day they might say, you are the best person in the world, but the nurse from the last shift, she's absolutely terrible. And so they start saying, you're good, they're bad, you're good, they're bad. So everybody's good or bad, and then they try to get people to work against each other. And it's kind of a game, but they don't see anything wrong with what they're doing. The antisocial actually has any disregard for other people whatsoever. They have a lot of, they're characterized by exploitations. They may repeatedly break the law, be deceitful. They fail to accept personal responsibilities. We usually see this around or before the age of 15 by these individuals having conduct disorders. You also have your egocentric. These individuals have, as you can imagine, poor relationships, and they exploit others, and everything's about them to show that they're the best, and so they actually put others down to make themselves look good. With your borderline, they're very unstable. So they have their affect, identity, and their relationships are all unstable. They're usually self-destructive, as you can see here in this video where this individual was cutting themselves. They have this fear of abandonment. They do that splitting behavior, splitting others against each other. Very manipulative and very impulsive. They may even be suicidal. They also try, again, the self-mutilation, and they are usually a high risk for suicide. They often try self-mutilation, as I said, and sometimes it's for attention or just to see the reaction that they can get. One of the ones I think is very interesting, and I think because I know someone who has this disorder and they keep going in and out of treatment, is the narcissistic disorders. These individuals are very arrogant and egotistical. They have a very grandiose view of themselves and their self-importance. They have this need for constant admiration. They actually lack empathy for others. They're often very sensitive to criticism. They don't like to be criticized whatsoever. They may even go into a rage, and they expect special treatment. Charles Manson, I can't think of the girl's name, the one who was at the trial, and she ended up marrying the boy who was the Mormon. They were going to get married. They were having relations, and then she stabbed him several times, and then she tried to turn things around that it was all him, and he was attacking her, and so forth. And I can't think of her name. I'll probably think of it before we have class. You also often see many movie stars, actors, actresses, and politicians who also have this disorder, and that they're very, what we say, a narcissistic personality. One of the things that we want to think about when we're thinking about the nursing process is safety. We need to keep them safe, especially those at risk of harming themselves or others. Being consistent. Consistency, even with setting limits, needs to be the same, rewards, and so forth. We need to make sure that we set boundaries and make sure there is appropriate self-disclosure. In other words, not going beyond and not being manipulated by the others to go beyond those boundaries. On the assessment, we're going to look over these points here: their behavior, their affect, their cognitive abilities, their social abilities, any influences that come from a certain culture, and any age-specific characteristics, and even developmental delays or developmental milestones that they haven't reached. Okay, and then here's your assessment for your Cluster B personalities. When it comes to communication, those in Cluster A, you want to approach them in a very gentle and non-intrusive manner and show interest. With Cluster B, it's definitely important that you use consistency and you limit the setting. You want to make sure you maintain a good, clear communication among the staff as well, especially when it comes to splitting. And then Cluster C, you want to point out any kind of behaviors that are very avoidant and any secondary gains that they may be trying to point out any secondary gains that they're trying to receive. When you have an angry client, we need to have ways to work with them. So you always want to make sure that you're calm and use a very unhurried approach. Do not touch them indiscriminately. That can actually end up hurting you and really set them off. Respect their personal space. Use active listening skills, and always remain aware of your own personal feelings. Interventions for the antisocial personality disorder. You want to, again, set them, approach them more in a matter-of-fact way, again, and you want to show that you are concerned. Make sure that you are consistent. You communicate in a set manner, and you maintain consistent rules and regulations. Do not argue, bargain, or rationalize with them. You want to confront inappropriate behaviors, and you do not seek approval or coax them. Use choices and consequences with them. Be alert for flattery or verbal attacks. Interventions for the manipulative behaviors. They should be assigned one primary staff member. You want to maintain realistic limits with enforceable consequences. Give a rationale for their limits and consequences. You want to model respect, honesty, openness, and assertiveness. And you want to confront the client each time manipulation does occur. Our last slide talks about illness management. So we want to teach them about their diagnosis and the etiology, and explore how past events can influence the way patients think about themselves and others. We want to also connect their patterns of thinking to their moods and emotions. We also want to provide information on treatment processes. And lastly, explain that changes do occur slowly, and the process will take time. It's not something that happens overnight or within a week.